Hello and welcome to this webcast, which is part of our series on the impact of sitting and health. To discuss his recent research, with me is Dr. Emerson Sebastiao. He's an assistant professor at Northern Illinois University in the United States. Emerson, it's great to have you on. Thank you so much for joining.
Thanks for having me.
Emerson, do you recommend that people use also technology or what we have now, apps that help us to either monitor how much we're sitting and how much how physically active we are, and actually use that? And is that practical?
Yeah, definitely. I just want to highlight that it's important that we have a clear definition, right? What is like sedentary behavior, in this case, sitting time, and physical inactivity. People normally get confused. Those are two different constructs nowadays that we have in science. One being that sedentary behavior and including sitting time are all those activities that we perform in a sitting, laying, or reclining position that do not require high amounts of energy expenditure. And physical inactivity relates to the idea that individuals are not meeting the current physical activity guidelines, the so-called 150 to 300 minutes per week of moderate to vigorous physical activity, right? And this is important, and because those are independent factors that can negatively affect health. So therefore, sitting time is a problem, as I mentioned before, for everybody else, because sitting time is highly associated with a large array of negative effects on different health outcomes, not only for older adults, but for children, adolescents, and adults in general. In terms of technology, it's not something that is new, to have kind of a technology being used to promote physical activity. But modern wearable devices, and right here I would like to highlight fitness track or smartphones and smartphone applications, they hold high promise in help individuals not only track, but also to promote a physically active lifestyle. But the main issue is that we have so many out there, which one I should use? There's a lot of researchers that devote their time to trying to validate those trackers and the metrics that they claim to provide, just to make sure that they are accurate, and then people can use that in a safe manner, and actually will help them to achieve physically active lifestyle, and down the road better health, better quality of life.
And in your opinion, what are some of the ways that we can maybe address the issue of prolonged sitting in older people, and where should people focus their efforts on for optimal health?
We constantly say that nowadays public health has a double challenge. One is to increase physical activity, and at the same time, they also need to come up with strategies and initiatives to make people sit less and move more. This idea of interventions on how people can be a little bit more active has not been highly studied yet, but we do have some ideas that we can draw from previous study that has been done in work sites, much more like adults, not only older adults per se, where they use this idea of nudge, trying to get hints to the employees, especially those that have behind the desk type of job, using the computer or the cell phone, for example, to send out messages and say, "Oh, it's been that you have been sitting here for more than 1 hour. What about stand up and take a break?" So normally we've seen in the literature actually that individuals that have higher amounts of breaks throughout the day, they tend to have a better cardiometabolic health. So meaning that replacing sedentary time by light, intense physical activity, standing up, just walking down the hallways to get a coffee, to chat with few other employees and come back after 3-5 minutes, seems to produce a very important, change in terms of cardiometabolic health that benefit the individual. So the main idea is to try to educate. As far as the older adult population goes, we know that most of them are retired, and we have a the entire spectrum, I would say, right? So we need to take into consideration that some older adults have some health conditions, which is not uncommon, that prevent them to be, highly active. But anything as simple as, if you're watching TV or you're reading a book, you need to try to time yourself, self-monitor yourself, in the idea that, okay, for example, I'm watching TV, and to every single commercial break, I will stand up. I will stand up and stick around until my TV show comes back. And then I can sit down again and watch the next part. As soon as the next commercial break comes in, I will stand up and I will do something in a standing position. Now, I'm not talking about this idea of people standing up and start doing squats, push-ups, anything along those lines, because it seems it's not that clear, but we do have some evidence showing that light intense physical activity, standing, walking few steps, waiting around for 3 minutes, and then sitting back, it's important. The main idea is that it's not about the total amount of sitting, because nowadays, if we look at our societies everywhere across the globe, we have many different situations where the sitting is kind of necessary, when you're driving, public transportation, and then your job. So therefore, the total amount will always be high. But the more important than the total amount of sitting time is the amount of breaks that you have. It seems that prolonged and uninterrupted sitting time is the biggest issue rather than the breaks. So if I can have the same individuals, two individuals sitting for a total of 10 hours sitting time in the day, but individual A sits 5 hours and then one break and then 5 hours. And then individual B, for example, has like many breaks every hour. So the amount of breaks is more important than the total amount of sitting time per day. So therefore, like most of these interventions that we're seeing is to trying to break that sitting time, that prolonged time that people's been sitting.
Can I ask one more additional question? And that is, in your study, you looked at, older people in Brazil, and the median sitting time there was 3 hours. But the median time in the United States, for example, would be significantly higher. What is driving that difference? Why are people in Brazil, especially older people, spending less time sitting, and what are they doing in comparison to the people in the United States, for example?
Yeah, something that I want to call the attention is we use the median, right? So the median is one of the ways we have to analyze the data that is somehow get rid of what we call outliers, not those people that doesn't present the kind of a normal values that we expect. So based on that, my values is a little bit lower. I think that if we had used the mean as other studies use here in the United States, for example, we would have higher numbers. As I mentioned before, the range in terms of sitting time in our study was 2 hours all the way up to 6 hours. So probably our mean would be a little bit higher. In addition, we use a self-report questionnaire to access one sitting time. And it's important to understand that every time that you're using self-report, there are some bias that are pretty much inherited to the instrument, right? But also there is this idea of social acceptable behaviors. It's pretty common, for example, for individuals to overestimate the amount of physical activity that they do when they self-report, because it looks good, right? So, physical activity, I know that it's important. I don't do as much, but I don't want to look bad. So I tell that I do a little bit over that I normally do. And sitting time, people know that is bad. So therefore, it's not an acceptable behavior. So people tend to underestimate. So this might be one of the issues in my previous study. Since we use self-report, people may have underestimated the total amount. And that is true because when you compare studies done here in the United States, for example, when they use self-report and an objective measure of sedentary behavior, for example, accelerometers, they found a way higher amount of sitting time or sedentary behavior when you compare to self-report.
Got it. Thank you. And maybe as a follow-up question, do you think, is it enough for us to focus on reducing sedentary behavior in older people, or do we also need to bring in resistance training activity as such part of such a strategy?
Excellent question. Physical activity is good, but it is not a panacea for all the bad things that we have out there. The most up-to-date physical activity recommendations that we have is from the World Health Organization. There was, and in terms of older adults, they require, or it's recommended that older adults engage in at least 100 to 350 minutes of moderate intense physical activity, aerobic physical activity, plus engage in what they call multi-component exercise or functional training that will include resistance training and balance training as well for at least 3 times per week. So if we are looking to develop, increase or improve health, improve quality of life, and keep that older adult active in the community, this is the minimum amount. And it's important to highlight that is the north direction for the minimum. The more that you do, it's more likely that you're gonna get more benefits, right? But it's really hard for older adults to engage in that amount of physical activity, as we've seen by previous study. Roughly here in the United States, I'm not sure about worldwide, but in the United States, less than 50% of the adult population engage in the recommended amount of aerobic activity, 150 to 300. When we're trying to see who engaged in both aerobic plus resistance training, that number drops to 25 to 30%. So we have a long ways to go to trying to figure out ways and to make people more active. There's several different initiatives. Researchers have trying to understand what they call barriers or obstacles, constraints to physical activity. And it seems that for older adults, 2 things stands out, right? One is health issues. That's why one of the reasons that they highlight for not being, or report for not being physically active. And the other one is lack of social support. And this coming from friends and family, and as well social support from the community. And this is really important, having like accessible types of exercise, safe places for them to go, places that are pleasant to be. Here in the United States, we have an issue that we have a lot of parks. Yes, we do have a lot of parks, but most of the parks are not well maintained. The maintenance is poor, so therefore it's not attractive. The aesthetics of the environment is not as they would like to be. So therefore, they say, I don't go. We also have issues with lack of sidewalks, potholes, cracked sidewalks. So all those things, if you put together, thinking that this idea that some of them will present with, I would say, significant level of mobility impairment, there's a big issue right there. So when you think about promoting physical activity, particularly in the older adult population, we need not only the health sector to start with initiatives, but it needs to be a collective effort from urban design and planning, park districts, health sector, of course, engineers. Those are all sectors that need to come together to try, if we are to improve physical activity in this population, because we have seen more and more how complex it is for individuals to partake regularly in this type of behavior.
Emerson, thank you for sharing all this, and best of luck with your further work. Yeah, thank you.
Thank you so much for having me. It's been a pleasure, and good luck for you as well.